Hello, happy Monday. These days are flying by. Okay, so I wanted to talk today about the different functional medicine providers, okay? Because I'm not getting a lot of questions, but I'm seeing a lot of different things and people are just, I think, confused. And I talk a lot about people who dabble in functional medicine. And while I love anyone who tries to bring lifestyle approaches into their practice, fantastic. That is where all healthcare needs to start. So going back, I've seen this out there a few times. I don't know if it's a meme, but it says that if your healthcare provider is not asking you what your diet is before giving you a blood pressure pill or cholesterol pill, then that's a problem. Always, food is medicine. So I digress. Okay, now I am a board certified nurse practitioner. I have a specialty certification in functional medicine. I have a PhD in holistic nutrition. That allows me to blend the best of both worlds, right? So I laugh and I always say I wear different hats. And even when I review labs with people, I say this is my traditional medicine hat. And if you were in my office in internal medicine or as your PCP, this is what I'd be telling you and this is what I'd be looking for. And then we drive down a little deeper into looking at optimal lab values rather than the traditional values. Because I always like people to know that when I look at lab values, I'm looking at the Goldilocks optimal values. I want to see the diabetes coming 10, 15 years before we have it, right? I want to see the insulin resistance when your insulin is around 6, not when it's at 26. So I can mix the best of both worlds. There are other like homeopaths, naturopaths. Some naturopaths can prescribe, some naturopaths can't prescribe. I think it's state specific. But so these are some questions you should be asking. And based on what you're looking to accomplish. So in my practice, I can prescribe. I am a prescriber as well. So you're looking for bioidentical hormones, you need a prescriber. If you're just looking for some nutritional support, lifestyle support, you can go more like a coach who a lot of functional medicine, holistic people, technically, legally are coaches. A lot of chiropractors dabble in functional medicine. They can do functional medicine testing. They are not prescribers. So again, depending on what you're looking to accomplish, you might want to see what everyone is doing. And everyone's education is different. I never take offense when I'm asked for my credentials. And I'm not saying that a non-prescriber is any worse, not worse, but not as good as a prescriber, because you have to be careful. We want all middle of the road, right? I am functional medicine heavy. I use a prescription pad when and if we need it. I say I've got a lot of tools in my tool belt and I'm not afraid to use them. But I would rather not go to a traditional medicine provider and think they might be able to give me some holistic functional medicine treatment, because that cannot happen in the confines of an insurance-driven industry, an insurance-driven system. It just cannot work. And that's because you're tied, you're obligated to the insurance companies to abide by their guidelines and their recommendations. That is why if you walk into a traditional medicine office and have cholesterol above 200, you are walking out with a prescription for a statin. That is how it has to be. Because when you sign up to participate with an insurance company as a healthcare provider, you're signing an agreement with them that you're going to do what they tell you to do. So it's not, it's not the provider's call necessarily. And this is why I hear from a lot of people that they get dismissed from their PCP because they get dismissed from their PCP because they won't take the statin or because they haven't been to the office in over a year. Because again, that labels you as non-compliant as far as the insurance company goes. So when the insurance company comes into your office and audits records, which is their prerogative if you sign on that dotted line, they are looking to see who's taking medication, who's not taking their medication, why you're still seeing them, why you're letting them walk out of the office with cholesterol above 200 without a prescription. I heard the other day, which really made me sad. A woman went to a new office, never had high blood pressure ever, has one high blood pressure reading in the office, and was given a blood pressure medicine. And she said, well, I'm not going to take this. I never had high blood pressure before. And she was told by the provider that she had no choice. She had to take it, or else she would have to write in her chart, that she refused to take it and all this other nonsense. But it used to be, and I hope that this provider was just a little too aggressive. I don't know. But it used to be that one high blood pressure reading in an office, that meant you go home, you monitor your blood pressure for the next 3 weeks, bring in your blood pressure journal, and we will see what it looks like. But now, if these guidelines are so tight that you are literally having to walk out of the office with a blood pressure medicine after one high reading, that's scary. But that's kind of the difference of everything. So you want, you kind of want someone middle of the road. I think it's nice to have someone who can write a prescription in case, there would be reason for it. Also, not only that, but if you're a prescriber, you have a much broader knowledge base of medications, unless, of course, you're a pharmacist who does functional medicine. So everyone has a different strength. And I think you need to, as a consumer, you need to understand that. Like, you need to understand what the questions are. So go into looking for a functional medicine provider, thinking about what you want. Are you looking for peptides? Are you looking for all natural support and you don't want to take anything? You never want a hormone? Great. If you want something more anti-aging, bioidentical, something like that, then you would want a prescriber. Every one of these specialists brings something different to the table. And I don't think there's a right or wrong. It's just a matter of you knowing the difference and knowing, who would serve you best. Also, my opinion, and I think all functional medicine providers who are fully educated and certified in functional medicine understand this. Functional medicine tests are, your deep dives, your Dutch hormone test, your GI map stool test, any of your genetic tests. All of these tests, I will tell you, require a whole lot of education. So if your functional medicine provider, and this is why traditional medicine people do not do any of these functional medicine tests. I know GI doctors who have looked at a GI map and said, I don't know what this is. Well, no, because I have like 40, 60 hours in training on that one test. So you can get all of these labs now. You can get them anywhere. But they're only as useful as the person interpreting them. So, if you take this to someone who has no idea what a GI map is or what a Dutch test is or how to interpret it, then you're going to have wasted a few $100s because it's useless unless you can put it into a treatment plan and use those results to help you get further in your health journey. Even how I look at traditional labs is the deep dive. I'm connecting the dots. I'm not looking at cholesterol and saying, oh my gosh, your cholesterol is high. No, I'm looking at your cholesterol, your triglycerides. I'm looking at your insulin. I'm looking at your ApoB and your your lipoprotein A. So I'm looking at all of these things and putting them together. Then we're looking at your liver. Is your liver converting, making your cholesterol? What is it doing? So it's never a one size fits all. And lab interpretation is much more complex than looking at, a standard lab report and saying, oh, everything's normal. I don't see any red flags on this, because the lab will trigger a red flag. The lab triggers abnormal lab values based on disease levels, right? We're looking at optimal. Okay. I hope that helped somebody. Because again, know when you're going in to talk to a functional medicine provider or want some testing done, want to have the deep dive into your labs, or, again, want the more advanced testing, please make sure that you're getting it from someone, or you're taking it to someone who knows what they're doing with it. Because, hi Susan, because it's useless if the person interpreting the results doesn't know what to do with them. All right, everybody have a great day. I will probably see you Wednesday. Give me some questions. What should I talk about?